Edutainment Studios welcomes you to On Bended Knee, Knee Problems. This module is part 3 in a series of 7 about knee problems. Although a knee problem is often caused by an injury to one of the 3 bones, ligaments, tendons, cartilage, or to the bursae, it may have another cause. Some people are more likely to develop knee problems than others. Many jobs, sports, and recreation activities, getting older, or having a disease such as osteoporosis or arthritis increase your chances of having problems with your knees. In this course, the objective is to help you learn how knee problems are diagnosed. Diagnosing knee arthritis and other problems will begin with the physical exam and medical history. To assess the medical history, your doctor will ask you questions such as, what symptoms are you experiencing? Are your symptoms worse after activity or rest? Are there certain activities that make them worse or better? How long have you been experiencing knee symptoms? Do you recall having an illness or accident around the time your symptoms began? Are you experiencing symptoms in any joints besides the knee? Do any of your family members have arthritis or other knee problems? Do you have other medical problems that could be causing your symptoms? During the physical exam, your doctor will look at and touch your knee and any other joints you may be having problems with. Your doctor will be looking for areas with tenderness, pain, or swelling, as well as indications that the joint may be damaged. Your doctor may also ask you to stand up and move your knee joint to see how well you can move it. Depending on the findings of the history and exam, your doctor may order lab tests and imaging tests to help make or confirm a diagnosis. Imaging tests can allow the doctor to see inside your joint painlessly. There are many different types of imaging tests that can be used to diagnose knee problems, the most common being an X-ray. A standard X-ray is a simple test in which an X-ray beam, a form of electromagnetic radiation, is passed through the knee to create a two-dimensional picture of the bones that form the joint. The doctor can use X-rays to view joint alignment. Problems with alignment can cause or worsen arthritis-related changes in the joint. Joint space. Narrowing of the space between the 2 bones, which are normally covered by cartilage, can be a sign of arthritis and its severity. Bone spurs. Bony overgrowths at the joint are a sign of osteoarthritis. Fractures. Anything from a thin crack in the bone to a complete break can be seen. A bone scan is a specialized radiology procedure used to examine the various bones of the skeleton in order to identify areas of physical and chemical changes in the bone. Bone scans are used primarily to detect the spread of metastatic cancer. For this test, a nurse or technician injects you with a radioactive dye and then takes a scan of your bones. The picture shows areas of cells where the radiation is concentrated, which can mean that there's an abnormality. It does not necessarily mean that there's a tumor. Other things such as arthritis or bone fractures can also make a bone scan abnormal. Your doctor can use this test to find out if a bone tumor has spread to other bones, or if a soft tissue tumor has spread to bone. Computerized axial tomography, or CAT scan, also called a computed tomography or CT scan, is a non-invasive test combining X-ray equipment with sophisticated computers to produce multiple images of the knee. The computer can combine the individual images to create a 3-dimensional view. CT scans show soft tissues such as ligaments and muscles more clearly than traditional X-rays. This makes them more useful for diagnosing certain knee problems, such as a torn meniscus. Magnetic resonance imaging, or MRI, is a procedure that uses a strong magnet linked to a computer to create a picture of the knee joint in black and white and shades of gray. Because an MRI shows the soft tissues as well as the bones, it is particularly useful for diagnosing injuries to the cartilage, tendons, ligaments, tendons and menisci, as well as areas of swelling. Arthroscopy is a surgical procedure typically utilized by orthopedic surgeons to visualize, diagnose, and treat problems inside a joint. A biopsy is when a tissue sample from the synovial membrane, which is the thin layer of tissue that lines most of your body's joints, is extracted with a needle from a diseased joint and sent to a laboratory for microscopic examination. A joint biopsy can be performed on any major joint, such as the knee, shoulder, elbow, hip, ankle, or wrist. It is typically done when only the results of less invasive tests, such as arthrocentesis, are abnormal or inconclusive. Please feel free to investigate these sites and others for more information, and remember to bring any concerns or questions in to discuss with your doctor. Thank you for joining us today for part 3 of 7 on knee problems, and please join us for part 4.